Okay, so let's just quickly discuss what the notes of appendectomy. So it can be laparoscopic or open. Open is basically the basic conservative surgery, and laparoscopic is done through ports. So what do we do is that whenever we do surgical removal of the appendix, we always leave behind a stump. Okay, but this stump portion should be less than 4 millimeter. Why? Because if it is greater than 4 millimeter, then stump appendicitis can occur later. Okay, so always remember that one of the complications of appendectomy is that if you leave a stump of greater than 4 millimeter, then stump appendicitis can occur. So this is kind of a dilemma that you always have to leave a stump behind, but it should not be more than 4 millimeter. It should be less than 4 millimeter. Okay, so what are the indications? We know that acute appendicitis or any complications, or if it's perforated, or in case of perforation, we simply do a laparotomy because peritonitis occurs. And in case of appendicular neoplasms, okay. Now, what are the steps? So basically, the first thing that you have to do is that you have to give an incision. So there are several types of incision. The typical one is known as the gridiron incision, which is also known as the McArthur. So you should remember all the names for one incision. So we have the gridiron is also known as the McArthur incision, and this is the most common incision. So how do we give this incision? So this is a hypothetical diagram. Let's see that this is the umbilicus and this is the anterior superior iliac spine. So we draw a line between the umbilicus and the anterior superior iliac line. This is known as the spino-umbilical line. Okay, so if we give an incision almost perpendicular to this spino-umbilical line over here, this green line you can see perpendicular to this spino-umbilical line, but a little bit tilted to the left. So let's just give this incision again with a marker on the paper. This is the umbilicus and this is the anterior superior iliac spine, and this is the spino-umbilical line. So the gridiron incision would be at 90 degrees, slightly tilted towards the left like this. Okay, so you can see that there's an angle of 90 degree over here, and it's like a perpendicular to the spino-umbilical line but slightly tilted towards the left at the upper pole. Basically this is the upper pole. Okay, so why is it given like this? This direction is actually similar to the fibers of external oblique muscle. Okay, the hands in the pocket direction, so they can be incised along this direction. Now another type of incision that we can give is the Lanz incision. Now this Lanz incision is actually cosmetic skin crease incision. It's also known as the Bicken's incision, and it is given at the lower portion, and we can see this orange line over here. Then the third type of incision that we can give is the Morrison's incision. Now this Morrison's incision is also known as Weier's incision, and it is also known as a lateral extension of the McArthur incision. Okay, as we see that this is the green line and then there is a pink portion. Okay, you can see that there is a pink portion in front of this green line. So we can say that this was the McArthur incision, and then we extended it laterally, then it became the Morrison incision. This is mainly done in pregnant females who have appendicitis. Okay, now the fourth type of incision is the midline incision or the right paramedian incision. We know that it will be simply a midline incision. I don't need to draw it specifically. Okay, and there's also one more type which is known as the Rocky Davis or the horizontal incision. Just remember the name. Okay, not that important. So these are the 5 incisions of appendectomy.